for everything that we do, it's about life preservation. So you are talking about cholera. That's an issue that's already knocking on our doors. And cholera is not harmless. It kills if not well managed. So it is very important that it's dealt with adequately and promptly. So your question is, what is it that must be done to avert cholera? First is safe water and sanitation. That's always the entry point because this is a waterborne disease. So there has to be safe water and good sanitation. Treat all drinking water. It's a must. If you can't treat it, at least you have to chlorinate it. You have to purify it. If you can afford and you have the funds to drink bottled water, please go ahead and do it. But even the piped water that we have is not safe enough. Our infrastructure is obsolete and a lot of pipes do leak. A lot of pipes are running parallel to sewer lines. So we are not safe at all. And apart from safe water being accessed, there's also the issue of storage. Water must be stored safely. Clean containers, and also ensure that these are closed when you store that water. There's the issue of waste disposal, especially our waste, the human waste part of it. Let's use latrines where they are available. Let's use our toilets. But much more important is the latrines and toilets must be clean and disinfected. Let's try by all means to ensure that human waste does not come anywhere near our public spaces or private places. So it takes a lot of effort to ensure that there's good sanitation. Number two, what must be done is hygiene promotion. Cholera is all to a large extent about promoting hygiene. So safe water is critical, as we have already said, but wash your hands as regular as possible with soap, with the disinfectants. We struggled quite a lot in the times of COVID, just maintaining hands clean. We have habits at times of coming from the toilet without washing the hands, and then you're greeting everyone away. Yonkani yo tisiye chabe cholera ilipafupi ya bwera. And after using toilets, of course, it's a must that we must do it. Preparing food before eating, we must always wash our hands. There's the issue also of safe food practice. Food is also one of the mediums that cholera is transmitted. So let's cook our food thoroughly. Let's wash our fruits. Let's peel our vegetables as much as we can. And let's also address the issue of food in public spaces. We normally buy our food on the streets and eat in places. And it's high time that the government, the councils, the local authorities moved in and help the people to ensure that those spaces where food is sold are also clean. As individuals also, if we can manage, let's minimize a lot of the food that we buy and eat in public spaces. Times are bad, times are dangerous. There's the issue of the environment, just keeping it clean, both at the private level and in the public spaces. Unfortunately, our cities are some of the dirtiest on the continent. In other words, we are relatively dirty in terms of where we live, how we live, and that is a very good attraction for cholera. So it's high time to clean those cities immediately if we haven't done it, but now it's a question of life and death. It has to be done. There has to be community volunteers that help us to get this work done, because without community volunteers, this cannot be done. This must be trained and deployed, and they should also help in terms of case searches, finding out people that are affected or infected in the communities. They could also be used in terms of distributing hygiene supplies and rehydration salts. And it's better done also engaging the local leaders, whether traditional leaders, church leaders, all types of leadership must be involved in getting this done. There's a third element, that's the medical response. There has to be a medical response since this is a disease. What I've talked about so far is about what you do at the private level, at the community level, but there has to be a medical response, and part of it is about seeking early treatment. Early and rapid dehydration is the most important treatment when it comes to cholera. And we should also administer ORS wherever patients, even just those appearing with low levels or moderate diarrhea, they should be treated, especially in the high-risk areas, as potential cholera cases. I'm not sure if your facilities are able to vaccinate, but technology is there today where you can do some emergency vaccination campaigns in very high-risk areas. So this has to be targeted. It's useful in the sense that it can provide short-term protection while other interventions are being put in place. Last but not least, I think there's the issue of coordination and of a multi-sectoral approach. Normally, it's the Ministry of Health that leads those activities, but other line ministries get to be involved. Traditional leaders, church leaders, as I had earlier alluded to, the private sector must be involved. There has to be effective communication. So far, I don't see that effective communication. So media houses have to be brought in because you are part and parcel of information dissemination, and your involvement is key in spreading the messages how to prevent and deal with cholera.
Okay. Now, let me just make mention that we are live on the Hot FM Zambia Facebook page, also live on the Socialist Party page as well. So feel free to get to any of those two live streams, leave a comment, and we'll go through your comment as the show goes on. Now, cholera keeps returning every rainy season. What structural or governance failures are at the root of this problem? And how would a Socialist Party government permanently break this cycle? Because citizens just expect cholera to sprout every year.
Strange enough, some of us did experience a time that Zambia had no cholera outbreaks. When we were growing up, there was a time that we did not experience this issue. But it started coming up as soon as our health system collapsed, as soon as our infrastructure in the urban areas could not match the growing population, and there were very low investments, public investments to dealing with cholera. That's when we started experiencing it. So cholera is associated to a failed system of governance, and that's what must be dealt with promptly or urgently. And that's what also citizens expect from their governments. We mentioned water as a critical conduit for transmission. That's why it's called waterborne. Today, 8 million Zambians still lack access to basic drinking water services. This is less than about 15% in the urban areas and 47% in the rural areas. So there's that urban-rural disparity when it comes to access to water. But having improved access to water does not necessarily guarantee you safe water, and I'll try to explain that. Even in the urban areas where we have piped water, you have all these taps and all that. But when electricity is not there and these taps are not working, when the sewer systems are obsolete, when you have a system of sanitation that is not closed, that is not safe enough, contamination of the water sources is always possible. So with that, even when you talk of improved water access, it doesn't necessarily mean that the water sources, our piped water, is always clean. This is a very serious issue. It's a structural issue. It's a governance issue. It's a developmental issue. And the Socialist Party feels like there isn't enough funding going to this area. Without funding into the water sector, into the sanitation area, nothing much is going to be achieved. You will be experiencing the recurrence of cholera and other waterborne diseases day in, day out. And the Socialist Party is emphatic about that. If you can deal with waterborne diseases, you are actually going to manage 30-40% of the health burden of this country. So prevention is better than cure, and the socio-economic determinants of poor health are critical, and the Socialist Party is emphatic about this issue, that more investments have to get into it to ensure that we have improved access but also safely managed services. So in the long term, again, there's the issue of improving the overall infrastructure, but clean hygiene in public spaces, even if you have invested in the infrastructure, is always going to remain an issue. It also depends on the behaviors of the people, the practices of our people, how are people conducting themselves. You can have the best 21st century infrastructure, but if the behavior of the people is not matching to what is needed, you always have problems. We have to continue, starting from our kindergartens to the tertiary institutions, educate our people. At the community level, we have to continue educating our people that good health is about good hygiene, and there are no shortcuts to it. The Socialist Party feels strongly that a foundation for good health are people that are aware of the dangers that are there in certain practices. And when people become aware, you can actually even avert or moderate poor infrastructure if your health-seeking behavior is much more better informed.
Okay. Now, we know many rural health posts remain incomplete, understaffed, or lack basic medicine. How does the Socialist Party plan to rebuild Zambia's health infrastructure, especially in rural and peri-urban areas? I think this is a critical issue.
Yeah, very, very critical, and also a loaded question. There are a lot of issues there. I've talked about funding. Today, our budgets normally commit something in the range of 8 to 10% to the health sector. And there were times when this country would commit up to 12%, but the real spending into the health sector is much less than that. So there were moments, years, where we only allocated 6%. The Socialist Party says this is a joke. That's why in our manifesto we have talked of 20% investment of the national budget in the health sector, or to the health sector. Even that 20% is not sufficient, looking at the disease burden of this country. So we must socialize health. Socializing means that every one of us plays a role, not just through taxation, but plays an active role in ensuring that there is good health. We can go into details about how do you socialize health? How does everyone become a participant in the attainment of good health? But funding and socializing the resources that are needed in terms of health is the way to go. The key issue, is it the elephant in the room? When you do that, where does that funding go? That funding goes, 60% of it, to staffing. It's called the health workforce. So the health workforce is the pillar. That's the one that carries any health sector worldwide. Yes, medicines are important, infrastructure is important, and a number of other things. The systems, the information are all critical ingredients in producing good health. But the first and most important ingredient of good health is staffing. It's the health workforce. So it's said that health is a skill-intensive industry. Drugs cannot replace the medical doctor or a nurse. A good building will never replace the services you get from a doctor or a pharmacist or a nurse. So the biggest investment of the Socialist Party will go to increasing the staffing levels. And very quickly on the staffing levels, today, if you talk of the doctor-patient ratio in Zambia, that is, every doctor is responsible for 12,000 patients. That's incredible. What does WHO say, the World Health Organization? The World Health Organization says that moderately, even for a relatively poor country, you should be looking at 1 to 5,000. I will repeat that. 1 to 5,000 is the recommendation of the World Health Organization. In Zambia today, our ratio is 1 to 12,000.
It's more than double.
It's more than double the WHO recommendation. Meaning, even if you had the best doctors in the world, they can't do the job. We have studies that show that some of our doctors actually work 100 hours per week. What's the normal working hours for the average Zambian? You are talking 40. 40 hours, that's what you work for in a week. But you have medical doctors that are working 100 hours in the week.
How does that affect healthcare?
It simply means you are short-charged. The burnout ratio the burnout amongst our doctors and nurses or health workers is very, very high. So at the end of the day, you don't get that smiling doctor or the smiling nurse. Many people say the doctors, the nurses are rude. These are burnt out people, completely burnt out. They overwork more than in many other places. And even as much as they work like that, they are not recognized sufficiently. If you look at the differences in terms of wages or salaries of our nurses, doctors, compared to Zimbabwe, even Zimbabwe, by the way, compared to Botswana, Lesotho, Swaziland, South Africa, there is a huge gap there. They are better remunerated. That's why you find there's a brain drain. Our doctors, our nurses are running away from Zambia, going to other countries. They work hard, more than many other people, but they are paid relatively less compared to even the neighboring countries. So the brain drain is not going to stop. The burnout of our health professionals is not going to stop. And also, you are not going to get the best out of them. Many people are going to complain about rudeness, about people not caring, and so forth. Please look at their working conditions. Look at how much they take home. Look at their housing. And also look at the hours that they're spending in those facilities. So we have to up the game as a country. We have been joking for years and years over the past, I think, 30, 40 years now. This has been a very, very big joke. We have to change that drastically. We need more doctors in the country. We need more nurses. Our people are overworked. But there's also something, Chisha. This is 70%, for example, of the doctors are in Lusaka and the Copper Belt. These are two provinces. The two provinces are taking up 70% of the available medical doctors, meaning the other 8 provinces of this country are only getting 30%. So the urban-rural disparity when it comes to the distribution of medical doctors is high. And the same applies to the nursing staff. So in as much as we are complaining about the urban areas, the situation is even worse when it comes to the rural areas. The other issue where the money is going to go from the Socialist Party is in drugs and medical supplies. If you remember, the government came up mid this year with a report that there has been a marked improvement in terms of availability. They put it at 80.5%. That is up from 46% in 2021. However, there is a September study that says that there are still persistent challenges. The supply chain bottlenecks are still there, medicine theft is still there, and inconsistent stock levels and distribution is still a challenge that we are facing. There has to be and there must be improvements and efficiency in the overall system, from procurement through the Zambia Medicines and Medical Supplies Agency, ZAMSA, to facilities and to the patient level. Local manufacturing, I may touch this a little bit later, but local manufacturing is key. We cannot avoid local manufacturing, increase local manufacturing if we have to deal with this issue. Allow me also shortly, because the question was on infrastructure. Our buildings in some of the rural areas especially, even in towns, are dilapidated. They don't look okay, they don't look clean. The rooms, hospital rooms or clinic rooms are pathetic. The water and sanitation situation, go to any health facility and check where the water is coming from. At times, water is not even running. Waste disposal, and again, hospitals deal with some of the most dangerous waste. You are talking of biological waste. You have had a cesarean operation. What do you do with the fetus that you've extracted? You have had syringes. What do you do with those sharps and needles? How do you dispose them? And so forth and so forth. So you have chemical, biological, and other types of waste that emanate from service delivery. And our disposal system are pathetic. The incinerators in many places, especially in the rural areas, are either non-existent or they are not working. And I would urge people that are interested in health, look at the surroundings, just the surroundings of your health center. Get into Chongwe, get into Kafue, look at where the hospital is, look at the surroundings, look at the toilet. There's nothing to write home about. there's a lot of change that is needed. Medical equipment, even where it's available, many times is dysfunctional. And you always get this complaint from the medical professionals that because of power outages, the medical equipment is not being used or has been damaged. And of course, you can't insure it against the damage because of the erratic power supply that we have. We have had situations where because of lack of power, people have ended up dying, and this is all documented. It's all in the public domain. There's also an issue that I'm passionate about that needs a lot of improvement. This country did invest in it. This is the health management information system. We invested as a country coming up with a relatively fair, good health management information system. Other countries came to learn from Zambia, but it's, I would say, dysfunctional as of now. The patient level records, for example, are also not the very best. You can't deal with the health sector if your information system, if the patient records are in disarray. Our dream as a Socialist Party is to be able to trace the medical history of a patient from the time you were born, or even before you were born, what were the issues with your mom to today. That is important. That case history is key to try to find out what could be the causes of your health problems. And without that, it's not possible. Is it doable? Yes, it's doable, of course. With the digitalized world and cost-effective technologies that are coming in, it's achievable, and it must be achieved. So there is work needed, and the Socialist Party, that's why it says we invest 20% of the national budget in it. We try to socialize to ensure that these constraints that we are facing today are adequately tackled.
Okay. If you just tuned in, this is the Socialist Hour brought to you by the Socialist Party. Our guest is Dr. Cosmas Musumali. He's the Secretary General and First Vice President of the Socialist Party. We're having a conversation around healthcare in Zambia and the plans that the Socialist Party have for that sector. My name is Chishambambe. I'm your host. Now, doctors, nurses, and pharmacists continue to leave the country due to poor working conditions and low pay. You actually alluded to that, the brain drain that we're experiencing. What is the Socialist Party's plan to retain skilled health workers and make the sector more attractive?
First is pay them well. Pay is not just about what the average civil servant in Zambia gets. It's also about the relative comparisons with the neighboring countries. If, for example, medical doctors or nurses are paid well in Botswana, Lesotho, Swaziland, South Africa, then they'll leave Zambia and they go there. They're in high demand. Our medical doctors are in high demand. Our nurses are in high demand in the UK, in Australia, in New Zealand, in all these Commonwealth countries, even in the US today. So if you have to retain people that you have trained as a country at high cost, both from the government point of view, but even from the family point of view, their remuneration scales have to be different. It's not just about the domestic factors that you put into your calculations, but also the relative attractiveness of this skill, the universal attractiveness or global attractiveness of the skill. That's how you do your calculations for medical people and other skills that have got a global attraction. So you can't treat them like anyone else because of that. So pay them well, but have enough numbers so that with those enough numbers, they can provide their best. Quality cannot be assured where people are overworked. Where somebody is putting in 100 hours per week, you can't assure quality. You can't assure good patient care at that level. So we have to have numbers. And again, it's not rocket science, by the way, estimating the number of people that we need. So for each country, for a country like Zambia, we know the disease burden. What is that affects us? How many Zambians are ill? We know that. The records show that. We even know, for example, how many women gave birth last year, how many women were pregnant, and how many of them delivered safely. we can approximate 5 years from now how many women are going to deliver. And if we can approximate that, we should be able to say how many doctors do you need to be able to attend to that number of women? And how many midwives do you need to train? At what level to be able to handle the caseload that's going to be available? So these are called full-time equivalents. So you have to calculate the full-time equivalents that are needed for the different professions in the health sector and ensure that your training institutions that prepare this country for health challenges of the future are adequate. They are able to match the expectations of the future. So we are able to do the calculations, but the calculations, training the people is one thing. And as we earlier said, they have to be employed, they have to be placed, and placed in a way that does not advantage the urban areas over the rural areas, but they should also be remunerated adequately. There have to be incentives for working in the rural areas. Indeed, working in the rural areas is not the same as working in the urban areas. There are no chances there for moonlighting, for going to other places and any extra money. You don't have that in the rural area. So you are stuck somewhere in Shangombo, in Lukulu, in Kaputa. You are stuck in Kawambwa. You don't have those opportunities. You do not have opportunities for training, for attending some of the workshops as others would do that are nearby the capital city. So all that must be thought through. And the Socialist Party, again, says it is going to make it attractive to work in the rural area. You'll get a hardship allowance much better than what is there today. Your level of effort is going to be acknowledged and appreciated in monetary terms also. Promotions are also going to be based, for example, how much diverse experience you have in urban areas, rural areas, in different circumstances. But we also have to emphasize the issue of specialization as we move ahead. We have a small number of medical doctors, well-trained, and a number of them not employed. They are looking for jobs 2-3 years down the road. They are still not employed, yet the country needs them. And then at the end of the road, after some years, they are still medical doctors in general terms. We need to specialize a good number. The rough idea is that at least 30% of your medical doctors should be specialists in different fields. The world is changing. Even diseases do change also. And some special technical expertise is needed to deal with a number of these complications that we face in our lives. And the Socialist Party has spent a lot of time looking at that and also consulting experts in the different fields in terms of need, both in terms of the expertise, but also in terms of the facilities that we have to have, both at the provincial level, at the tertiary level, in order for us to match the disease burden that we are currently experiencing.
So one would say paying health workers more is very much welcome. No one would argue with that, but some would say, will ask, where will the money come from? Where will the Socialist Party galvanize these funds to pay these health workers more?
So if you are apportioning 8 to 10% of the national budget to the health sector, definitely there's no money. If you are putting 20% of the health sector, of the national budget to the health sector, then you have more space to be able to remunerate the people adequately. I'm not sure that it's about more money. I think when you talk of more money, it's like there's more, it's more than what is needed. It's not even more money. It's about adequate, appropriate remuneration of the health professionals. Because if you don't do that, they will run away. If you don't do that, they don't provide the service that you expect out of them. Is the country capable of funding, of paying their doctors better? The answer is yes. Allocate proportionally more resources to the health sector. Make your government lean, by the way. We are putting more money in ensuring that the whole bureaucracy, the ministers and others are well paid. This country is spending government resources to buy elections. We are talking of millions and millions of dollars every year. Every by-election, you have all these helicopters flying, you have all the DCs converging. They use fuel. Those helicopters don't run on nothing, on thin air. And hiring them or putting them out there, again, these are millions of dollars that are spent every year. So it's a question of priority. It's not a question of not having the money. Our priorities are totally wrong. We are not prioritizing where the lives of our people matter. We are ready to find the money and run by-elections. And by the way, the money for by-elections does not come from the political parties. In this case, it doesn't come from the UPND. These are government resources that are being used by the people that are getting into these by-elections, by the agencies, even government agencies, your ZESCO and many others that make a contribution direct or indirectly. These are all resources that could be channeled to more productive areas, and the health sector being one of them. So if somebody says we don't have the money to pay the medical doctors, then you shouldn't have the money to pay anyone, because we have to make choices at times. Are you ready to pay for the bureaucracy, for the politicians that highly compared to your medical doctors? Who is more important, the politician or the medical doctor? I would say the medical doctor is more important to the people. A lot of our politicians are just charlatans and at times even thieves, outright bandits.
All right, this is the Socialist Hour here on Hot 87.7. Good morning to you if you're watching us live on Facebook. Good morning to Teddy Sakala, who says he's listening from Feira constituency, Luangwa. Good morning to you. Philip says he's listening from Lusaka Central constituency. Bibi, and also listening from the Copperbelt. Sherry Mubonda watching from Namibia. Good morning to you. Thank you so much for joining us. We're talking about the health sector here on the Socialist Hour. Our guest is Dr. Cosmas Musumari. He is the first Vice President and the Secretary General of the Socialist Party. Now, here's an important one for you, Doc. Public hospitals continue to suffer drug shortages despite repeated government assurances. Now, what alternative procurement and distribution model does the Socialist Party propose to ensure uninterrupted medical supplies?
So again, we have a system, by the way. And as I said, Zambia is not short of systems for procurement, for distribution, for the storage of drugs, and for the disbursement of these drugs. This system has been refined over a 30-year period, actually. And there's been a lot of work. Millions of kwacha, or even maybe a billion kwacha, has gone through trying to refine that system. The institutions or organizations that are responsible for procurement of drugs and medical supplies have also been changed from time to time. Medical stores, today you have ZAMSA, and so forth and so forth. We have highly trained people, highly trained Zambians in all these areas. Sub-Zambians in procurement all over the world today. If you go to the UNDP, you go to the World Bank and so forth, some of the best procurement people are Zambians. They come from this country. So we are not short of people. We are not short of systems. There is no political will. There's simply no political will to ensure that the trained people and systems can work for the betterment of Zambians. Health is a cash cow, and drugs are also a cash cow. The previous governments, and even this government today, if you look at the levels of corruption and look at issues of effectiveness and efficiency, they have used health either to skim money, to fund political activities, or just to ensure that they can manipulate voters by providing drug kits to this particular area where there's a by-election, and to that one where there's a by-election, just to show people that things are working. So without political will, without proper leadership that really cares for Zambians, the problem is going to be consistent. Systems don't work on their own. They work under a solid political policy or system. Currently, we don't have that. We have not had that under the PF. We do not have that under the UPND. There's also the issue of local content or local manufacturing. I mentioned it a little bit earlier. We have the essential drugs list. Basically, these are the drugs that this country needs to deal with the disease burden. And the disease burden is well articulated, is well known, is well documented. We know what are the major causes of morbidity and mortality in this country. And we have the protocols as a country, how to treat that, both in terms of prevention, in terms of treatment, and post-treatment or rehabilitation. We have all that. We have all those protocols. We have worked out as a country in terms of what are the standard drugs and medical supplies that are needed at each level of intervention.
Okay.
But getting that to work has become the constraint. When you don't have enough people, health professionals, when the political will is not there to put the drugs where they belong, when you have to depend on donors to find your drugs and supplies, when a lot of these have to be imported into the country, then stockouts are almost programmed. At this hour, 61 years after independence, nothing stops us from producing even some of the most sophisticated drugs. Zambia is capable of doing that. We can buy the technology. We can hire the expertise if we don't have it. At least the first 150 critical drugs must be produced in Zambia. It's a security risk for the country. If, for example, all your HIV drugs are brought in from outside, so your ARVs, because especially if they are brought in with the donor funding, a good number of them, when the donors pull out, and we have seen it with the Americans pulling out, this is a very, very serious issue. And we have seen EU pulling out because of corruption issues in the procurement, in the health sector. It's a very, very serious issue. And also, you don't rely on foreign suppliers forever. It's a way of creating jobs. It's a way of ensuring that things are in order. And they can only be in order if we have capable local production, if we have got companies or factories that produce drugs locally. It's time that is done. By the way, in the 70s, there was an attempt, and pretty successful, and that went on into the 80s. But with liberalization of the economy, with the privatization, with the free flow of imported drugs, we killed the pharmaceutical industry. It's being revived now slowly. But again, the political will that is needed is not there. There are more lip services being paid to a local pharmaceutical. You still have cartels that ensure that the bit of drugs that are there are exorbitant. They are pushed up, and all that must be dealt with urgently.
All right. Now, we were talking about cholera earlier. Now, we know cholera is essentially a water and sanitation problem. How would the Socialist Party overhaul waste management, drainage systems, and access to clean water in compounds and high-density areas?
It's not a short-term solution. So what we talked about, wash your hands, clean your water, cook your food and all that, with the help of communities, use ORS, and clean the surroundings. These are very short-term solutions, and they have been tried over and over. And they are repetitive. Each year you go back to all those things. People know them, actually. The key issue is get your water system running. You can't run a 21st century country or cities, towns, even villages without clean water. A sanitation system is archaic. In some places, non-existent. We have had very, very little investments going into that sector. If my memory serves me right, our investments in that area is less than 5%. And I happened to one time being closer to the water and sanitation sector. I was a chairperson for NOASCO for some time. And I can attest that the situation in our water utilities, or just in the urban areas where water is supplied, is below par, is below minimum. And you can get on the Copper Belt today, get into Ndola, Kitwe, get into Chingola, and look at the water supply system. The pipes, the leaking, the contamination of the water. A story has to be written. It hasn't yet been written because it's worse than many people imagine. So huge investments are needed. what has happened in the past is that rehabilitation has normally been done under donor or cooperating partner support. We have not pushed in our own money. And these are areas, for example, those that love PPPs can come in. Water still gives you money. Our people in towns would be ready to pay a little bit for their water if the infrastructure was there, if the water was clean, and so forth and so forth. We have resorted now to drilling our own boreholes, but drilling your borehole, putting a tank, and getting water into your home is a very, very costly thing. It's pushing up the cost of construction of homes in this country, terribly so, because this is supposed to be a centralized resource that you pay for or that you get at cost-effective tariffs. But we are not there yet. So there will be investments. And the Socialist Party talks of the People's Infrastructure Development Program, where we talk of a $1 billion at least being dedicated to this particular issue. And a good proportion of that will go to the health sector. Now, raising a $1 billion for infrastructure is not out of reach of this country. Of course, it's not just about water, it's about the other aspects of infrastructure that are needed. But with a budget of, let's say, $16 billion, you can afford to put a $1 billion every year to infrastructure, and water becomes one of the best or greatest priorities.
Now, let's talk load shedding. It's affected cold chains for vaccines and disrupted operations in hospitals. What would the Socialist Party do differently to shield critical health institutions from energy instability?
Our last program actually was on energy.
Yes, it was.
And we talked about energy security is key. And you are raising a point where energy interfaces with health, because energy interfaces with education, energy interfaces with industry, energy interfaces literally with every sector of the economy. And I had talked about energy being like your transmission mechanism. These are gears, the whole transmission mechanism that gets you to move from one end to the other. So even the health sector today cannot run without energy. Now, what has happened with the load shedding is that a lot of equipment has been damaged. And please, those that are in government, check again with a lot of the health facilities. They will complain that the equipment is damaged because of load shedding or the power outages that have been there in the recent past. The second issue is about not having energy to operate those machines. So a lot of the machines, whether it's your operation theater or your diagnostic equipment, they need some form of power. And we haven't reached the level where solar power, where diesel power is sufficient, has got a wide coverage to ensure that everyone or every health facility can make use of it and run a health institution appropriately. So again, a consistent, reliable power supply is important to run the machines, to ensure that our diagnostic equipment is in order, to ensure that treatment equipment is in order, and so forth and so forth. So without energy also, you cannot do a lot of the rehabilitation that's needed. And to rehabilitate, to ensure that a lot of the equipment or tools that you need, there has to be one form of energy or the other. And we are suffering under that. Health facilities are suffering under that. Actually, it's a mess. If there's an area that has tried hard to get alternative sources of power, these are health facilities. So if you go into the rural areas, you find in the health facility, they have a solar panel, they have this and that. Those that are able to, they have some generator, and then they will tell you, we have not had supplies of diesel to run the generator. It's a mess. The word is, it's a mess. And we have to come out of that again. More investments are needed. That's why for us, you can't run the health sector at 8%, 9% of the national budget. You need to put minimum at 20% to deal with all those issues that are needed.
All right, well, coming to a close now, it's a question that always pops up. How can one join the Socialist Party? Some people follow the a lot of people follow this program. They ask, how can they join Socialist Party?
The Socialist Party is represented in all the 10 provinces. So if you are at the provincial headquarters or anywhere, just ensure that you talk to the leaders. And what we'll do maybe is in the next program, we will avail phone numbers of contact people, even here in Lusaka, and then we should be able to connect you to the leadership wherever you are. If you're in Lusaka here, the ward is your entry point, and we'll be able to give you the contacts. It's an easy process in terms of joining the party. Just declare interest. We'll demand one thing from you, that is you join, also attend some bit of classes in terms of what socialism is all about, what we want to achieve, what our aspirations are, and you'll be part of us in this revolution.
Okay. All right. What are your final remarks as we close up today?
The final remarks on health is that we have not done well when it comes to our health. We continue to struggle. We struggled with HIV, we have struggled with COVID, and we continue struggling with recurrent issues like cholera. It shows that both structural behavior change issues have not been dealt with effectively. And without proper funding, without a political will, these problems will persist. And that's why the Socialist Party is there. Our program, our aim is to improve and empower Zambians as far as their health is concerned. Zambians will own their own health. They will participate in providing health, and they will be the captains of their health. Without good health, there's no life, and life is not possible. So we think any political party worth its salt has to prioritize health as we do.
All right. Well, I'd like to thank you so much for joining us today.
Appreciate it. Thank you very much.
All right. Well, this has been the Socialist Hour, brought to you by the Socialist Party. Our guest has been Dr. Cosmas Musumali, who is the Secretary General and the first Vice President of the Socialist Party. The show comes to you every Wednesday right here on Hot FM. My name is Chisha Mwambe. I am your host. Make sure you catch the show next Wednesday when we get to talk to different leaders and members of the Socialist Party.
The views expressed on the Socialist Hour are those of the Socialist Party and its guests, and do not necessarily reflect the opinions of Hot FM or its affiliates. Thanks for tuning into the Socialist Hour on Hot FM. Stay informed, stay engaged. Tune in next Wednesday at 9 hours for more lively debates and inspiring ideas. Let's build a better world together.
Explore the world with us. Welcome to ArcSafe Travel, your travel management company. Join us for exclusive Zambia's local tours exploring the breathtaking beauty of the national parks, beaches, waterfalls, and cultural heritage. Our international services will whisk you away to the city lights of Cape Town, the romantic streets of Paris, the dunes of Dubai, the waves of Zanzibar, and much more. From personalized itineraries to hassle-free bookings, our 24-hour travel consultants are here to make your journey seamless and spectacular. Perfect for corporate, solo travelers, families, honeymooners, and everyone in between. Don't wait. Call us on 0211-291-024, 0967-252-514. Visit us at plot number 28, Kwacha Road, Olympia, Lusaka. To start planning your adventure today, ArcSafe Travel, making your travel dreams a reality.
Your weekend is about to get exciting, and extra spicy. Welcome to Lusaka Legacy Resort, where a special weekend rate of only 2,800 kwacha gets you dinner, bed, and breakfast at the most serene prime resort in Lusaka. Start your day at our Sunset Cafe, open to guests and